This is Dr. Daniel Paul with Easy Orthopedics. And today I'm going to answer the question, can you pop a ganglion cyst? Yeah, you can pop it. It's just not a good idea because it almost always comes back. So what do you do about it? Well, before I get into that, let's just talk a little bit about what a ganglion cyst is. So ganglion cysts almost always occur on the wrist. They can occur on the back of the wrist or on the front of the wrist. And what are they? Well, every joint is surrounded by a capsule. And sometimes, for whatever reason, part of the capsule gets weak and a bunch of fluid ends up pushing out through the capsule and kind of creating a cyst. It can also happen in your knee. It's called a Baker's cyst. So people get these a lot in their wrist and around their hand, and they actually make up about 60 to 70% of hand masses. So yeah, people don't like them. They're big sometimes. They don't look good. Sometimes they hurt. If the cyst is near certain structures, it'll actually cause pain. Or sometimes people just don't like it being there, knowing that it's not supposed to, and they just keep feeling it and they want to get rid of it. So they'll attempt to pop it. They actually used to call these Bible cysts because people would take the Bible and just smash the wrist trying to pop it. And so why doesn't that work? Well, you can pop it, but the problem is there's a stalk, and when you pop it, you never get the stalk, and it almost always comes back. And in the meantime, you're smashing your wrist with a giant Bible, depending on the version. You can cause yourself a lot of pain and also hurt your wrist, so I don't recommend that. So what do you do? Well, you could also go to the doctor, and sometimes they can stick a needle in it. Not recommended so much for cysts on the front of your wrist because there's an artery that runs right near there, and sometimes you can hit it. But you can certainly try on the back of the wrist. Now, again, the problem with that is you're not getting rid of the stalk, and it works less than half the time, meaning that it comes back. So what do? Well, the last option, which actually is fairly common for a ganglion cyst if it's bothering you, is surgery. And what I do as an orthopedic surgeon is you got to open up the cyst and you got to trace the path back right down to the stalk and remove the stalk. And that's the best way to get rid of it. Even when you do that, cysts on the back of the wrist have about a 5% chance of coming back, and cysts on the front of the wrist have about a 15 to 20% chance of coming back, even after all that. So they can be a big pain in the butt. Just know that popping is not going to work, injection's probably not going to work, and surgery is your best bet, and it'll probably work, but it still might come back. And then people have these second surgeries and whatnot to get rid of them. So again, to get back to the beginning, I wouldn't pop it. You're just going to hurt yourself and waste your time. I hope I was able to answer your questions about popping ganglion cysts. If I didn't, feel free to ask a question below, and I'll do my best to respond. And thanks for watching my video.